There are two groups of patients that come with genital edema. Some of them are post-cancer treatment. The other group have genital edema without ever having had cancer. Now that might be because they are severely obese and just the amount of pressure in their body causes the genital edema. There are others who maybe have a susceptibility to it, and then maybe just something else going on in their life, like a diagnosis of something intestinal maybe can cause a genital edema. So that's perhaps something that people wouldn't expect, and the patients wouldn't necessarily link the two in order to tell the GP that it's going on. And the other would be just trauma patients. Does the person have swelling in both their thighs? If you did a thumb press for about 30 seconds on the bikini line there above the knicker line, 10 seconds even, you would see a thumbprint that maybe wasn't disappearing. If there's swelling in the skin all around here, then you can almost guarantee that the labia are also swollen in the skin here. Okay, and then the shorts, I just want to see how they're looking up on the waist as well. It's not cutting in. If you come across relaxed and confident in what you're doing, it helps them relax so that they feel more comfortable to expose the areas that need examining. Okay.
Doesn't help that I've put on a little bit of weight in the last few weeks.
Well, Christmas is here.
I'm very, very respectful and very conscious of keeping the person's dignity at all times. Literally with your hands, grab this swollen bit and push it into your tummy. I utilise the towels and I cover up as much as I can in between talking to the person.
I'm a psychologist and I find it quite easy to talk quite openly using medical terms, using slang terms, whatever somebody brings to me. So I find it quite unusual when I go for a medical appointment and I still get the medically trained staff saying things like, "What's it like down there?"
So for the penis itself, especially now if you're going to the toilet and you are finding that for whatever reason it's more swollen than usual, it's literally a matter of hold the penis and just gently squeeze it.
Squeeze.
So then skin, it's really healthy. It always boils down to looking after the skin because this area is particularly fragile and prone to leaking. It's prone to getting a fungal infection, or the more medical term is intertrigo. And that causes a lot of embarrassment because they feel as if their hygiene is at question, and it's not. It's because when this genital area is very swollen, it rubs and rests against the thigh, creating this excessive moisture. So it causes the skin changes. So knowing how to treat that, how to recognise the symptoms, because it'll alleviate a lot of the itching and discomfort in the groin. Put your hand there and then you're just pushing it in. So use as much of your hand as you can. Okay, now compare the right side and tell me what the difference is. The next thing is breaking down that fear of being able to touch the swollen area, teaching them how to bandage the penis if that area is swollen, managing the scrotal area, because there are loads of different ways we can compress. It's not just garments, there are ways that they can self-bandage, especially to try and help with toileting. And just gently squeeze it, and you'll find literally just doing that 10 times will soften it and hopefully make it easier when you do wee. I think that's the biggest challenge for men especially, is that they can't use the urinal because the penis is too swollen. It is about knowing that if I can massage and soften the area, that genital area will have some means of draining again into the body, which is eventually going to be weed out.
So it's a stroking movement up from the groin area and up into the armpit, up into the axilla, and then just sort of squeeze it away from the axilla there, and plenty of nice deep breaths, so it's helping the body absorb the lymph, and that offloads from the groin area.
This is the genital edema model we use to try and teach our colleagues how to bandage and massage the penis and the scrotum. The model is a bit crude, but sometimes when patients are too embarrassed to expose themselves, this becomes a good teaching tool as well. So to bandage the penis, we can either use a very gentle foam that we've pre-cut, and the soft side goes against the penis and they can wrap it around. And what's nice with this particular bandage material is that if you just rub it, it sticks to itself, and then obviously the compression shorts over the top can help. At the same time, you have a little end that will then stop the tip of the penis getting swollen as well. They can then just take that bit off, and then either replace it with a fresh one, or if this one hasn't been dirtied, replace that. This foam is quite ridged on the inside, so with the compression over the top, it softens the genital and suprapubic area. Make sure the seam is on the outside, as it should be. You put it on underneath the garments then, as an overnight wear. This is a soft bandage. There's two types. There's one that's cohesive, so it sticks to itself. This one's a non-adhesive one. So we tend to keep the soft side against the skin. And this is just about wrapping around the penis. Don't have to add any particular pressure, because as you go around and around adding the layers, that will give support and compression to the penis itself. This is step one. It's quite simple, and you've still got the little cohesive bit that you can just use to protect the tip of the penis, and that can just be replaced every time they go to the toilet then. This makes a massive change to the feel of the penis almost immediately. It immediately softens the consistency of the tissues. Very often I'll start off with scrotal supports. Swimming trunks can sometimes be just as useful. They can sometimes give enough support. We've got specific scrotal supports. They're called a Whittaker pouch, so you can try and get the scrotum into that. They come in different sizes. For a patient with scrotal edema, this can be quite tricky to try and get the scrotum in. And then you put the penis inside as well to give it added support. And then you've got a belt that goes around the waist. It's all about giving that lift to the scrotum. Lining materials. Now you can make a pouch out of these as well. You slip that over the scrotum, give it a twist at the bottom, and then you slip it back over there, and that's enough to hold the scrotum in place. But because the scrotum is so responsive to good compression, it does fall off and causes a lot of frustration to the gentleman as well, which is where these sort of pouches come in very useful as a sort of a next move or next step. We've got nice colourful pants for our children, because there is a small cohort of young boys and girls that have got edema of the genital area. We like the pink, it's nice and colourful. And then for the boys, we've got lovely little shorts. For our older, more adult people, you've got a whole range, and they come in different lengths. So this is almost a culotte style, right down to the mid-thigh. You can get them down to the knee as well if they're specially made. And then you get the shorter, more boxer-like styles for men and then for women as well. Another company produces what looks to be a very, very small scrotal support for men, but they do stretch. This material is particularly nice. It's got a weave in it that gives the skin a good massage as they're walking around. Right, so it's not cutting in there. No, giving good support there. And you say it's holding the scrotal area.
Yes, it holds it in place quite well. Yes.
It doesn't have to be a special medical garment. No. There are plenty of sort of
the hold me in
type things that people wear under they're going out dresses and going out trousers and things, the suits, just to make them more shapely. They're actually really useful, and they're usually quite comfortable. The main thing is that it's a nice even compression over the whole area. What we don't want to see is things that dig in hard somewhere, because that's going to stop the flow.
For information about where to buy these products, do drop us a line and we'll share our recommendations with you.